morning. I'm Bevan Koopman. I work similar to Guido on search engine technology, and I had a few slides that broadly covered my research, but after seeing Craig's talk this morning, I've decided to throw those all out and speak just about one project. And that was a project with Queensland Children's Hospital to build a search engine specific for finding targeted treatments for kids' cancer. I guess Craig's story was very similar to our patient advocate, who was Michael Horwood, or the Horwood family, whose daughter Charlotte had a very similar journey as well. And in particular, they, after some initial treatments, were able to find a specific clinical trial that was tied to the genetics of that cancer. The issue there, though, is really there's so much information out there, so much clinical trials and medical research, that even though nowadays any kid diagnosed with cancer will get genetic testing, when that information comes back to the treating team, they've got to then trawl through millions of articles, hundreds of thousands of clinical trials to find potentially that one key treatment that really we know makes a big difference in pediatric oncology. So what we tried to do is see how we can use neural network ranking technology to search all these millions of pieces of information for potential treatments that really match that patient. So we're halfway through that project. It's really designed about building an actual working search engine together with the clinicians and with the patient advocates to look at how we can bring these new large language model technology. So that's the underlying mechanism of ChatGPT, which is able to obviously understand natural language. All this information is all in natural language. And then how can we match that against the specific information for that particular patient? And how can we do that in a human-in-the-loop manner, right? So you had the example this morning of ChatGPT, can you write me a strategy? What you want there is the feedback to say, no, that's not correct. Can you please update that for me? Can you please pull in that extra piece of information? So what we're trying to do is have the clinician be able to drive the kind of search of what they're looking for, but have the model do the grunt work in terms of finding that for them, and hopefully really allow any child who's diagnosed with cancer, have the treating team really be able to fully find any evidence that might be there, any clinical trials that might be going on at this time, any piece of new literature that's come out in order for us to really find the very best option possible. And that's called the OSCAR project.